When we hear stem cells, we automatically think embryos. Well, this is not the case here. There are many other sources for harvesting stem cells, and that's what Dr. Bill Johnson of Innovations Medical is here to talk about
Hi.
with us now. Hi, Dr. J. Okay, so we've talked about stem cells many times, the innovations that you are able to provide so many people who have ailments, but stem cells don't only come from embryos.
No, in fact, in the United States, very few are using embryonic sources. We think of it coming from embryos because that's where all the controversy has come from. We heard about them using fetuses and taking the cells, and certainly that is used in the world, but not much in the United States. We have very firm restrictions on that. And certainly we're not using embryonic cells, we're using what's called adult cells.
Okay, so break this down where these stem cells are coming from when you use them with patients.
Well, we can get adult stem cells from you. We can get your stem cells. We can get it from your bone marrow, which has been done here in this country for 30 years. We can do it from your fat, which is a more recent innovation, but becoming increasingly popular because it's easy and we get a whole lot more cells. We can get it from your mouth, we can get it from your nose, we can get it from your intestinal lining, we can get it from your bones. So there are many places we can get stem cells. So we're choosing them based on how many we can get and how easy they are to get.
Okay, so why do you choose to harvest stem cells from fat?
Well, fat is probably the most readily available source of a large number of stem cells. We can get from a single harvest upwards of 100 million stem cells from one harvest. Bone marrow, by comparison, you can get about 20, if you're really good, and get maybe up to 60,000. So it's a difference between 60,000 and 100 million. There's a big difference there. And so fat represents a really easy source that we can get a lot of cells from.
Okay, this is generating so much excitement. Why is it such a hot topic right now?
Well, stem cells do two really special things. One, they can make more copies of themselves. So if you have one stem cell, you can make millions of stem cells, or really as many as you want. But the thing that really makes them interesting is they also have the ability to become other kinds of cells. So that fat cell that we're harvesting has the ability to become a cartilage cell, has the ability to become a lung cell, has the ability to become a nerve tissue cell or a muscle cell, just able to become many other cells and therefore heal tissues that before couldn't be healed.
These stem cells are like superheroes going in where no one has gone before and able to do things that only the superhero can do.
That's exactly right. And that's what we're able to do now is take them from fat where they've been stored waiting for an injury and put them in an area where that we can't respond well. In fact, they've been shown to hasten bone fracture healing and do some other things that we already heal. And now we're able to do some things that we couldn't do before.
Well, talk about the innovations when it comes to treatment. How are you using these stem cells? Where are you seeing the most results?
Well, we've got the most experience with osteoarthritis or degenerative arthritis. We've done a large number of knees, shoulders, hips, even hands and ankles and feet. And about 80 to 85% overall patients respond with the resolution of their pain. And there are a lot of patients that are able to do this procedure and avoid a joint replacement or other major orthopedic surgery.
That is really neat. Okay, so if you want to find out more, and I know you do, make sure you come back here every week. New videos are posted. Click below to subscribe and also like if what you saw today is pleasing to you. And always you can go to questions@innovationsmedical.com if you want to ask Dr.